Okay, let's get started here. Good morning, everybody. First off, I'd like to welcome you to our ARTARx presentation this morning. I'd like to introduce you to your presenters. My name is Jennifer Hope. I am the Affiliate Marketing Advisor at ARTA. We're also joined by Yatin Patel, and he is our Director of Pharmacy Services. We're also joined by Darren Tardif. He is our Manager of Pharmacy Operations. We also have Gary Sawatsky here today, who is our Chief Operating Officer, and as well as Amanda Shaw, our Chief Marketing Officer. So we have lots of ARTA staff here today to tell you about our exciting new initiative, ARTARx. ARTARx is Canada's first planned-owned pharmacy, and any ARTA members who are living in Alberta will be able to access it once it is opened. Yatin and Gary will be speaking to ARTARx's history and vision and the benefit plans, as well as Darren. And I'm going to speak to you a little bit about some ARTA membership advantages you receive when becoming an ARTA member. Perhaps some of you already are ARTA members and are well aware of some of the advantages you get being an ARTA member, but maybe don't know about some of the programs that you do get. So just a couple of housekeeping notes. I am recording this presentation and to post it on our YouTube channel. So you are able to reference this presentation in a couple days if you want a refresher. So you can just visit the ARTA channel on YouTube and you can watch this presentation. And we also have a bunch of other presentations about our new comprehensive plans that we have introduced. So for that reason, we have disabled your video and microphones just to ensure your privacy. And if you have any questions throughout this presentation, please use the Q&A function in Zoom. So the Q&A function is just the two little speech bubbles in the Zoom menu bar. So just type your question in there and we'll stop a couple times throughout the presentations to answer some of the questions live. Or Amanda and the rest of the team will answer any questions that you have typed into the Q&A. So anytime throughout the presentation, please use the Q&A function. Please refrain from using the chat. Everyone can see your questions in there and we're closely monitoring the Q&A. So let's get started. So I'm going to talk about some of the member advantages you get when becoming an ARTA member. So not only do you receive a really great retiree benefits plan when you become an ARTA member, there are some really great programs that we offer to our memberships, such as member discount programs. We have the Boom discount program, which provides our members some really great discounts on hotels, car rentals, gym memberships, various retail outlets, or discounts on admission to some attractions in Canada and some in the States. We also have discounts in some of the major cities with our recreation centers, so you can receive discounts on your gym passes. We also have our insurance partner, TW Insurance, who offers discounts on home and auto insurance. So you can just visit arta.net, search TW Insurance, and their page will pop up. And you can contact them to receive a quote and see if you can save any money on your home and auto insurance. And they also offer some really great life insurance programs that are geared towards our membership. Wellness is one of ARTA's strategic goals. And we like to promote wellness to our members through a variety of initiatives, such as an annual wellness challenge, where members can submit their time spent on any physical activity, and you can win some really great prizes. We have a photo contest where members can submit their work to different categories, and their work is published in our News and Views magazine and professionally framed if they are a winner. We have a writing contest if that's what you enjoy. We have fiction, nonfiction, poetry, different categories where members can submit their writings to us, and their work is published in our magazine, and they receive some really great prizes. We offer a really great scholarship program to our members' direct relatives, whether it be children, grandchildren, nieces, or nephews. We award up to $40,000 to the winners who are selected by our selection committee, which is comprised of retired teachers. We also have our ARTA apparel store where you can purchase really great ARTA branded clothing at a discounted price. So you can visit theapparelstore.net, take a look at the store, and if you want some really great discounted clothing, you can get it there. Regularly communicating to our members is very important to us. We have our News and Views magazine, which is distributed to our members' homes once every season. The News and Views magazine, if you're familiar with it already, has some really great articles on gardening, what our branches are doing, travel, wellness. So we're really proud of this magazine, and we know our members really enjoy getting it every season. We also have an Artifacts email newsletter, which we send to our members monthly, and that provides any information on ARTA, anything that's new that's happening, any articles that we feel are pertinent to our members. We put them in the Artifacts emails newsletter, so watch for that in your inbox. We also have our website, arta.net, which provides you all of the information you need to becoming an ARTA member, as well as any forms or anything that is new happening at ARTA. We're also very active on our social media platforms, Facebook, Instagram, YouTube, and LinkedIn. So if you are active on these social media channels, find the Alberta Retired Teachers Association and follow us so you can be up to date on any information that we need to communicate to our members. I'm now going to pass it on to Darren, and he is going to speak to the history and vision of ARTARx.
Actually, I think we're going to pass this over to Yatin here.
Yeah. Oh, sorry about that.
No worries. Thanks, Jen. The journey for ARTARx started several years ago based on feedback from ARTA members and working in consultation with benefit plan leaders and consultants. It's a creative way to kind of address the rising cost of prescription claims, which led to the development of feasibility and business models. These models were presented to the Health Benefits Committee by the ARTA executives and ultimately to the ARTA Board of Directors in consideration. The vision of ARTARx really for the exciting part for pharmacy professionals is the opportunity to practice clinical pharmacy at the highest level. Alberta is really a privileged area in the way that pharmacists have one of the broadest scopes of practice in the country, which allows pharmacists to really get involved in members' health and prioritize their goals and achieving those goals. ARTA leadership recognized the impact that pharmacy professionals could make and were willing to invest in the modernization of the delivery of pharmacy services, with the promised return to our members with better clinical care and pharmacy support. ARTARx represents an additional revenue stream that will facilitate the rising costs of prescription claims to ensure the plan is sustainable, healthy for future growth. Okay, thanks, Jen. So in 2020, the Board of Directors approved the investment of ARTARx. This is a for members by members approach to the pharmacy to again serve the members and provide stability to the plan. We've allocated about 4,000 square feet of ground floor space at the head office in Edmonton. The ARTA head office is in Edmonton. So right now we're in the construction phase of renovating that space from office space into pharmacy space. The ARTARx office or pharmacy will be licensed as a community pharmacy, a brick and mortar pharmacy that you can come and visit if you're in the local area. We'll also be facilitating services to our members that are outside of the region through mail order and delivery capabilities. So we'll be able to provide you with prescription products to your doorstep. The transit time with our partners we're hopeful to get within 3 to 4 business days. A common question is how long will it take medications to get to me? So, with our partners in Canada Post and various regional delivery companies, we're looking at 3 to 4 days maximum. The pharmacy team will be led by myself and with Darren, who will continue with the products and services that we'll be offering. So thank you.
Thank you, Jan. All right, so I'm going to jump in here, and I'm very excited to speak to everyone today about the unique pharmacy model that the ARTARx will be able to offer. And it's really interesting because ARTARx has ARTA members not only as patients and customers, but also as shareholders. So it's really in our best interest not only to have a very successful pharmacy, but to have a very successful clinical care offering, which is going to help people with health and wellness and achieving their health goals and outcomes. And so in this regard, we've done a lot of early investing into things like automation dispensing technology, as well as regulated pharmacy technicians. And this is going to support dispensing operations and make sure that the workflow is as efficient as possible. What this is going to do is it's going to open up pharmacists' time to be able to connect with members and to really offer that expanded scope of pharmacy service that you may have come to know and love from your community pharmacy. So for things like really care plans and managing medications, managing any sort of health concerns or questions, travel health clinics, immunization services, even prescribing when appropriate, those are all things that we really want to emphasize and focus on from a pharmacist perspective, because it really does bring benefits to the members. Now, having such an efficient system, we're going to be offering dedicated one-on-one time with the pharmacist in terms of supporting the delivery of those services. Now, I know there's a lot of people that can't necessarily get into the pharmacy, the physical location, to meet with us in our clinical rooms here, and that's okay. We're also going to be offering those types of interactions over secure virtual platforms, so online or over the phone. So for those of you who are not in Edmonton, in rural areas, can't make it through, we really still want to be able to offer you that really high level of service and care that you would expect from a pharmacist practicing at a high level. So that's really kind of a benefit of this type of a model. Now, the ARTARx pharmacy professionals are not only going to be offering their services in terms of those consultations, but as well as contributing to ARTA health and wellness programming. So things like the webinars, as I'm doing now, as well as our communication points, things like the news and views, artifacts, we're going to be lending our expertise to those types of mediums as well. So it'll be another way that you can kind of gain a benefit from having pharmacy members on staff and our expertise there. Now, one thing we're really, really excited about is being an education site for mentoring pharmacy students. Understanding that ARTA predominantly services retired teachers, we understand that education is incredibly important. And we're really honored and really gearing up to be a prime practice location or rotation station for U of A pharmacy students. And that's kind of our way of giving back and giving our expertise to the next generation of practicing pharmacists. So overall, you can kind of see that patient wellness is our priority, and really everything we're doing is being put back into the plan to make sure that the plan offerings and the benefits are just as good as they can be in terms of helping people achieve their health and wellness goals. And so on this next slide, I'd like to speak a little bit about what is ARTARx in terms of the features that we offer by the nature of being a plan-sponsored controlled pharmacy. And so with this unique setup, we're gaining a lot of interest from the pharmacy industry itself, and we're building partnerships with a bunch of different players in the pharmacy field to be able to offer features and things that you might not necessarily see in a traditional community pharmacy. So one question we do get a lot is with regards to over-the-counter products, things like your vitamins, your supplements, and worries regarding will people be able to get those from the ARTARx pharmacy? And the answer to that question is yes. So we've been partnering with some different suppliers to be able to provide those items to people at a very competitive pricing. So you don't have to worry about being financially burdened by bringing your prescriptions over for things like vitamin D, calcium, aspirin. That's stuff that we can not only take care of for you, but be able to put into blister cards or unit dose pouching, which I'll touch base on a little bit further on in the slide here. Another unique offering that we have is the pharmacy staff will be well trained in terms of assisting you not only with the Alberta Seniors Plan, but as well as the ARTA plan offerings, especially ARTARx for those of you transitioning. We do understand that sometimes navigating that system can be difficult, frustrating. And so, we're uniquely poised to be experts in how those plans communicate and how those plans offer you medications, things that need special authorization or things that have step-up therapy. We're really going to be able to assist members with that, with the ultimate goal of minimizing out-of-pocket expenses, making those retirement dollars stretch further for you in terms of the health system. So that's something we're incredibly excited about, as well as our pouch compliance packaging technology. So we've heavily invested into automation, which means that we're going to be able to offer this type of a setup where we can organize multiple prescriptions and vitamin regimens into these convenient tearaway packages, especially helpful for patients that maybe dose multiple times a day or have a ton of medications, especially small little tiny ones that maybe are very easy to drop or get lost. What we hope by doing this and having this offering is we can ease the administration burden and improve medication adherence for all of our patients. So that's something that is a feature of this type of a pharmacy. Now, I do understand that sometimes people are going to want a more familiar pharmacy experience as well. And that's perfectly understandable. And we are able to offer that. We've invested into vial filling automation as well. So for those of you that want that more familiar experience, you like the vials, you've got a system going already, you don't have to change that to come over to the ARTARx pharmacy. It's something that we're poised to be able to do and do very efficiently and effectively for you. So we'll be able to meet the demands of the members in that capacity as well. Now, one really interesting thing that we can do for those patients that can come into the pharmacy, at a pharmacy level, we set our own fees and we set our own kind of administration policies. So for things like travel vaccinations, routine health vaccinations, you may notice that you do have to pay a fee at your regular community pharmacy for those services. By the nature of controlling that structure here, provided patients can make it into our location, we can administer those vaccinations at no cost to you for the professional fees. So that's just another added benefit of getting you through the door and being able to see you face to face and doing those interactions in that manner. Now, as a benefit for those who maybe can't make it through or would prefer delivery for their medications, that's something that we can offer as well. We've been working really hard to partner with local delivery partners as well as Canada Post and some other vendors to be able to offer no-cost home delivery to the vast majority of Alberta. And so for patients that want to utilize our services but can't necessarily make it into the pharmacy, that's an option for you. Whether you're in Edmonton or outside, it is something that we can offer. And so those are really a lot of the features of this plan sponsored controlled pharmacy that we hope will benefit our members and really encourage you to use our services. So I don't believe we have any outstanding questions at this point. And so keep the questions coming in. What we can do is we'll kind of circle back and answer those at the end, but I believe I'm going to pass it over to Gary now to talk about some of the plans themselves.
Thank you, Darren. ARTARx is a few things. It is first and foremost a brick and mortar pharmacy, as Darren and Yatin just explained, with a different focus than a lot of the pharmacies out there. A lot of pharmacies currently work on volume. They try to get as many drugs dispensed as possible because they want to charge dispensing fees and report back to their shareholders and make them a lot of money. We're different than that. We don't have shareholders. Our members are our shareholders. And so we are taking a different approach. Darren mentioned some of the automated capabilities that ARTARx has. Anybody can count pills. It's not that difficult. The real services and value proposition that a pharmacist brings is their knowledge of how drugs work for a person's health. And so we have taken that approach where we're investing in our members and giving them access to those ARTA pharmacists in order to make sure that their health needs are being looked after in conjunction with the rest of their health needs. So besides the pharmacy, ARTARx is also a benefit plan. It's going to start to be rolled out January 1st. And for people who have agreed to move over their maintenance medications over to ARTARx for dispensing, we have a special benefit plan specifically for you, which I think you are going to enjoy. Next slide, please, Jen. We have much different coverage for people covered under ARTARx. Again, people who participate in the ARTARx plan are those who have agreed to move their maintenance medications over to ARTARx for dispensing instead of their corner pharmacy. If you do come to ARTARx for any medications, the plan is going to pay 100% for those medications. So you won't have to pay anything out of pocket. If you decide that you want to get a drug from your corner pharmacy, which may be wise, for example, if you were prescribed penicillin for an infection, you probably don't want to wait 3 or 4 days for ARTARx to deliver your drug to your doorstep. You can still go to your corner pharmacy and we will cover those drugs at 80%. We call those acute care drugs. They're taken for a relatively short duration of time. You probably want them right away. And so we are still going to cover that through ARTARx, no matter what pharmacy is dispensing it. If you can wait a few days before you get that medication and you want to get it through ARTARx, like I said, we'll cover it at 100% or 80% if you get it through another pharmacy. If you want to get your maintenance medications through a different pharmacy other than ARTARx, we're only going to pay 50% of the maintenance medications not dispensed by ARTARx. So it's really in your best interest to take advantage of the higher coverage level to move those maintenance medications over to ARTARx. And you can see that that compares favorably with the build your own plans that we currently offer, which all provide 80% coverage. Those plans also have maximum acquisition cost pricing for certain maintenance medication drug categories. The maintenance or the maximum acquisition costs indicate that we're only going to pay up to the cost of the second or third most expensive, second or third least expensive drug in that category. With the MAC pricing, we do not apply that in the ARTARx plan. So you can get access to some of those more expensive drugs. The prescription drug annual maximum increases. Right now, under our build your own plans, it's either $1,200 per person per year or $2,000 per person per year. We're going to bump that up to $2,500 per year per covered person. We also have some lifestyle medications covered under 2 of our build your own plans. We cover 50% of those costs up to $150 per year for hair loss and erectile dysfunction. If you're participating in ARTARx, we're going to cover those medications at 80%. And we're going to add a category, not only hair loss and ED, but also adding prescription weight loss medication applicable under ARTARx. And those do not have a separate inside annual maximum. Those are going to be included under the $2,500 per year annual maximum. Next slide, please, Jen. The rest of the healthcare provided is similar to what we provide, but a little bit better. We covered 90% of eligible expenses instead of 80%. The paramedical practitioners is covered at $1,400 per year combined per person. Hearing aids is $1,500 every 36 months. Accidental dental is $5,000 per year. Orthopedic shoes is higher than our other plans by 50%. Diabetic supplies is a little bit higher. Instead of $1,750 per year, that gets bumped up to $2,000 per year. And the ARTARx with travel plan also includes the excellent emergency travel coverage that our total health and ultimate health plans already include. Dental care remains optional. It's the exact same plans offered under the build your own plans currently. As a reminder, we have 3 different options for you to select from. The first, option A, is the most comprehensive. It provides 80% coverage for basic and preventative, plus 80% coverage for minor restorative and 50% coverage for major restorative. The minor restorative annual maximum is $750, and the annual maximum for major restorative is $1,600. Option B is the same as option A, but does not include any major restorative coverage. And option C is the same as option B, but covers at a lower level, 65% instead of 80%. And with that, I'll turn it back to Jen.
Thank you, Gary. So we have just recently introduced a brand new website, artabenefits.net. You can visit this website today. You can build your benefit plan. You can check which sector you are eligible in if you aren't sure. And also you are able to apply online. And you can also compare all of our benefits plans, including the new ARTARx plans. So if you visit artabenefits.net and you answer all the questions, there will be a question that pops up asking you if you are interested in one of the ARTARx plans. You can click yes, and a chart will come up with everything that we do offer in that plan, as well as the rates. So visit artabenefits.net, check it out, and it will guide you along and help you choose the best benefits plan that fits your life. And you are also able to apply online. So we are going to stop for some questions now. So if you have any questions, please type them into the Q&A box. And if you have any questions after this presentation, please email marketing@arta.net and one of us will get back to you right away. And if you have a question tomorrow or the next day, you can always email marketing@arta.net. Also, if you would like a physical enrollment kit that has our plan options, brochure in it, an application form, and as well as our rate sheets, you can email marketing@arta.net with your name and your address. And as soon as they're done printing at our printer, we'll send them out to you next week. So we'll just wait for some questions to come into the Q&A box. If anyone has any, please feel free and we'll answer them as soon as we can. Well, I don't see any questions coming in now, but again, please email us if you have anything. And that's all we had for today. And I just want to thank everybody for coming out to our ARTARx webinar.
Sorry, Jen, we did have a question in the chat box.
Oh, here we go.
Somebody asking if they do not choose ARTARx, does it mean that your current drug coverage drops to 50%? No, we're not changing any of the coverage under our current build your own plans. So if you have coverage with HealthWise, HealthWise Plus, Total Health, or Ultimate Health, those will continue unchanged. This is simply a new plan to give our members additional choice.
There's another question. When does the choice need to be made?
You can join ARTARx at any time. Bear in mind that we won't actually have a pharmacy until January 1st at the earliest, perhaps pushed back by a week or two at this point, given the construction delays that everybody is seeing right now. But you can join at any time. If you decide a year from now that you wish you had taken ARTARx and you're already covered by one of the ARTA plans, you can move over to one of the new ARTARx plans at that time.
Sorry, there's a question on how ARTA plan premiums are determined and can they change in the future?
Premiums are always subject to change. If you're currently covered by one of the ARTA extended healthcare plans, you know that the premiums just decreased starting November 1st. We review the annual premiums every year. We base the premiums based on the experience in the plan over the past year. Over this past year, we've had relatively good experience. And so we were able to reduce the premiums for both the base extended healthcare plans as well as the travel component. Travel component actually decreased by quite a bit because we haven't had a lot of people traveling over the past year. We determine what the premiums are for extended healthcare because it's not an insured plan. We self-insure those benefits, so we can determine what those rates are. Travel is different. It is insured by Allianz. And so we do have to negotiate any rate changes with them, which we do in conjunction with the annual rate renewal at November 1st each year.
Okay, just another question. Are you able to move back to another plan if you choose a build your own plan? That's what I'm thinking that they are asking here.
Yes, if you come into ARTARx and decide it's not right for you, you can move back. But we do ask that you participate for 12 months. So there's a minimum 12-month requirement to participate in one of the ARTARx plans before you can move back. But once you see the rates and the plan design, you'll see that the rates themselves are very close to our base extended healthcare plans. So the ARTARx plan with travel is very close to what we currently charge for total health. It's only a few dollars more per month. So you get benefits which are better than ultimate health with rates that are comparable to total health. So you may want to review those.
There was a question that I think probably everyone can benefit from hearing, and that was, how does it work if you need a physical service like a vaccine and you don't live in the Edmonton area? If one of you would like to answer that live, put you on the spot.
I'm good to take it, Darren, but recognizing there's that physical limitation, ARTARx has some, ARTA has some plans for our members in Southern Alberta, recognizing that's a big portion of our membership. At this point, we can't control what other vendors or pharmacies would charge regarding administration fees. So if you got your vaccine product from ARTARx, it could be delivered to your home in a temperature sensitive fashion so that it ensures stability of the product. And that would come through your coverage. Getting that injection would most likely be at a local injection site. They may or may not, depending on your relationship with them, charge an administration fee for that service. At ARTARx pharmacy, there would be no administration fee, and the coverage on the product would be the same through the ARTARx pharmacy. If you decide to get that vaccine product from your local pharmacy, we would not be considering that chronic medication, meaning something you could anticipate getting on a regular basis. So your coverage would be at 80% coverage, not 100% coverage, but still very good, very competitive, similar to what we have for total health and health-wise. But again, the issue would be getting that administration fee would be at the local pharmacy level. We are looking at options at this point, but that's what we have available at this point.
All right, so we do have a question here that I'm going to answer live. And someone has asked, will pharmacists be okay with administering products not purchased from them? Would they be concerned with quality? And it's a very good question, and it is something that anyone who's ever brought a vaccine in from another location might have encountered. A lot of places will have either policies or procedures that will not allow them to inject something that wasn't purchased from their store. And that just has to do with concerns with quality, yes, as well as, temperature control. Was it at the proper temperature? Is the stability of the product going to be intact? It's not necessarily something that the pharmacist can assess at that point when someone brings a product in. So for a lot of temperature controlled vaccines and things like that, if you do have to get it injected, it may be better to be able to get it from your regular pharmacy. And that's something that if you do have specific questions about products, I encourage you to contact your pharmacy that you're looking at going to see what their policies and procedures are. And then if there's still outstanding questions, you can contact any of the ARTARx staff and we can help to answer that question for you further.
There have been 2 questions that have come in about how ARTARx plan coordinates with the Alberta Seniors Drug Plan. Gary, did you want to talk about that a little bit?
Will do. ARTARx will be set up as a provider and will be able to coordinate benefits with the seniors plan as well. So in a lot of cases, if you are age 65 and over and covered by the Alberta Healthcare Plan for Seniors, that plan will cover most of the drugs that you would be getting. That plan covers 70% of eligible medications that are listed on the Alberta Drug Benefit List, and then the plan would pick up the other 30%. If you are dispensed a drug not listed on the Alberta Drug Benefit List and you are getting it through ARTARx, if you are covered by ARTARx plan, you will have that drug dispensed at 100%.
Thank you. We'll just see if any more questions come in. Is there, sorry.
There's a question regarding if there's a different rate for seniors that participate in the government program. No, we priced the rates based on most people likely participating in the government program. So that has already been taken into account in the rates.
Provide the website listing of drugs covered by the seniors benefits.
Yes, I don't know why I said I would answer that when we have 2 pharmacists online, but let me try. If you go to Google and search for the Alberta Drug Benefit List, it will take you to a Blue Cross hosted website. I believe it's, if you look for the interactive drug benefit list, that will take you to, I'm pretty sure it's idbl.ab.bluecross.ca. And on that website, you can search for any drugs which you may be getting, and you will be able to see what is covered under the seniors plan. If it is not listed in that interactive drug benefit list, then you would not have coverage for that medication through the public plan, but there's a good chance it would still be covered by ARTARx. And Yatin has provided a link to it in the chat box for you to copy as well.
Okay, so I think that's it for questions, but again, you're more than welcome to email marketing@arta.net and we will answer your questions as soon as they come in. So thank you very much for joining us today. We look forward to some of you joining ARTARx and reaping all the benefits that it provides. So have a wonderful day, everybody.
Thanks, everyone.
Take care.